Biomechanical bull. I can crack your back straight. I can reposition your wonky pelvis. I can change your lordotic curve and correct a leg length problem. I see this all the time on social media, and it really sort of gets to me sometimes because it's misinformation that the patients are receiving. Now, I love manipulation, and I think it's incredibly effective when you understand what it is for, how to use it in a clinical setting, and understanding what you're intending to get out of it. But it's not magic, and as I said in a previous post, people are claiming manipulation can do things that it fundamentally cannot do. And ultimately, a lot of therapists are still using manipulation with a purely biomechanical thought process. They are looking at the patient from a specifically asymmetrical viewpoint. What's the pelvis like? What's this like? What's that like? And actually, it's pretty damn flawed, that viewpoint, to be honest. And trying to fit manipulation in with it and trying to correct those problems, I think you really are struggling massively. Ultimately, guys, you cannot change someone's asymmetry with manipulation, all right? It's pretty much impossible. Everybody is ultimately wonky. All right. If you wanted to change someone's joint position, you would have to put sustained compression onto that structure for days, weeks, months, years. Think about the teeth, yeah? To correct the position of the teeth, braces. That's months, that's years of daily repositioning, and you think you're going to correct someone's pelvis with one manipulation? Guys, with manipulative technique, you have to understand we do not change the anatomy, we change the physiology. That is the key. We are not changing anatomy, we are changing physiology. We are manipulating the body's systems to try and create temporary change. Why am I using manipulation for this area? I am not correcting your wonky pelvis. Your pelvis is fine. What I am doing is I'm trying to create either a symptomatic modification, a change in your symptoms, reduction in pain, or a functional modification. Can I get you moving better? I'm not going to change the anatomy, but if I can manipulate the physiology to help with the loading of the structures, the exercise of the structures, the creating of the tissue resilience, that is the key with manipulation. So if your patients are being told that they're having structural things changed, moved and repositioned, it is significantly mis-selling. Manipulation is very effective. But ultimately, why do I use it? I use it because I want my patients to move without pain. That's why I use it. I want them to move without pain because that is my goal as a manual therapist. I cannot change the degeneration of a joint. I can't put a disc back in. I can't change the osteoarthritis within your knee. I can't change that. But what I can do is give you coping mechanisms and strength and stability and exercises to load the structures around it to create pain-free movement. And manipulation is part of that process, reducing your pain, reducing the tone, functional modification, symptomatic modification to get you into what ultimately is a loading phase to create tissue resilience. Please remember, guys, when we are using manipulation, we are not changing skeletal position. Boom.